Good evening, ladies and gentlemen. Welcome back to the Recovery Bank Community Education Series. My name is Frank Bollock. I'm the project manager here at the Recovery Bank. And for those of you that don't know, the Recovery Bank is a peer-to-peer community recovery resource center, and we're located at 120 Wyoming Avenue in Scranton. Our basic mission is to connect people in recovery, people who are new to recovery, with people who have had some experienced success in recovery. We also are looking to connect people in recovery with recovery resources, and we're looking to provide family members of individuals in recovery with information and resources that would help them. Part of that mission involves providing education to all aspects of our community. And in that regard, we have begun a community education series, which we've run for the past several weeks. We are offering the program on Facebook Live and Zoom. We're also recording the programming for playback on our YouTube channel. We've had some great success over the past weeks. We were encouraged by your support, and thank you for participating. Tonight, we have with us Barbara Durkin, who is a definite supporter of recovery and of the Recovery Bank. She is a member of the Board of Directors of Treatment Court Advocacy Center. Prior to her present position, she was the Lackawanna County Treatment Court Coordinator for many years. And for the last several years, she has been providing really super service to the recovery community in her capacity as the Executive Director of the Lackawanna, Susquehanna Office of Drug and Alcohol Programs. Barbara is going to speak with us tonight about all of the various programs that are offered through the Office of Drug and Alcohol Programs, including accessing treatment. Without further ado, Barbara Durkin.
Thanks, Frank, and thanks for asking me to be here tonight at the Recovery Bank. I'm honored to be part of the peer-to-peer recovery movement, not only in Lackawanna County, but across the Commonwealth of Pennsylvania. It's been really delightful to see the Recovery Bank get up and running and provide so many services to the residents of Lackawanna County. In my role as Single County Authority or Drug and Alcohol Director for both Lackawanna and Susquehanna County, I've had the privilege of seeing recovery centers open up across the two counties. We also have a recovery center in Susquehanna County that's located in Montrose, which is very similar to this one here at the Recovery Bank. So it's been really exciting to see the project start, and I'm honored to be part of this event here tonight. So, really just wanted to give an idea of the resources that we have available through my office. As Frank had mentioned, I am the director of the Lackawanna Susquehanna Office of Drug and Alcohol Programs. For some people who are watching tonight, or some people who will watch this in the future, we are the Drug and Alcohol Commission for Lackawanna County. Some of you might remember us as that. We're currently located actually right across the street from the Recovery Bank in the Government Center here in Lackawanna County, which is located at 100 Wyoming Avenue. We are physically located on the 4th floor of that building. Due to the pandemic, we are still not completely open to the public. However, we do provide walk-in access if necessary, and are facilitating screenings and assessments by telephone. But kind of going backwards, what we do is we provide screening, assessment, referral to treatment services for individuals struggling with a substance use disorder. We also pay for individuals to go to outpatient, inpatient, really any level of care, treatment necessary for someone who might be struggling. So the way you can contact our office, we have multiple ways, one of which is, as I mentioned, we're located across the street in the Government Center here in Lackawanna County. So you can physically go to that building and ask someone downstairs to speak to the Drug and Alcohol office. I have case managers who are in the office who are willing to assist in any way possible. We also provide resources and services via telephone. Our main telephone number is 570-963-6820. And then we provide 24/7 on-call services. So this is, I think, the most important number, which is one of the reasons why I'm glad this is being recorded. Our on-call number is 570-840-8475. So that number is available 24/7. A case manager in my office, and we have right now the most case managers than we've ever had before. We have 7 current case managers in our office, plus a case management supervisor, and they are tasked with answering that on-call phone 24/7. So if you yourself or a family member is struggling with a substance use disorder, you can call that on-call number, and one of my case managers will answer the telephone and assist you or your family member with whatever their needs are. And part of that process is really having a conversation with whoever is making that telephone call to determine, what's going on. Do you need treatment services? Does your family member need treatment services? And then connecting that person to the right place. Part of it is also just to have a conversation with the person who's calling to figure out what's going on. So we've been doing that for the last couple years, providing that 24/7 support. So that's been fantastic. Again, our main work is doing a screening if you're struggling with a substance use disorder, or otherwise known as an alcohol problem or a problem with drugs or alcohol. We'll talk to you either in person or on the telephone, and then figure out what the next scenario is for you. If you're someone who's calling and are looking for inpatient treatment or detox, say you're struggling with alcohol, you can't stop drinking or you can't stop using a substance, my staff will connect you to the appropriate treatment services, regardless of your ability to pay for such treatment. So we pay for treatment for individuals. We connect individuals who might be eligible for medical assistance or Medicaid with that. And if you have private insurance and for some reason have a high deductible or a copay that becomes a barrier to you accessing services, we can assist with all of that. So inability to pay or perceived inability to pay for treatment should never be a reason not to go to treatment. So leaving that out there again, our on-call number is 570-840-8475. If you or your family member is currently struggling with a substance use disorder, you can contact that number at any time. We also have our Lackawanna Recovery Coalition. We have a Facebook page, just like the Recovery Bank. We also have a website for the Recovery Coalition, so you can simply Google the Recovery Coalition, and there's a ton of resources on there for my office. There's some videos on there of people talking a little bit about their own struggles with a substance use disorder and how they've recovered. So those are some really good resources to connect to if you are, in fact, struggling and would like to connect to services. My office, in addition to kind of doing the screening and assessment, as mentioned, we pay for people to go to treatment. We pay for individuals to go to outpatient. We pay for individuals to go to inpatient. We are thankfully in a funding situation right now where there's no reason why someone can't access treatment services. We are finally at a place where we'll do a level of care determination and actually place people in the most appropriate treatment. In the past, we had very little funding and we were sending people to treatment for 14 days. Now we can actually pay for someone to go to, say, a 28-day stay inpatient or a 90-day stay inpatient, and then follow up with some, say, halfway house services if necessary. So we are in a good spot. So again, reiterating, if you or your family member are struggling, please give us a call. Even if you're not a resident of Lackawanna County or Susquehanna County, we can connect you in the right direction. In addition to kind of our major resources, which are the treatment piece, we have a lot of programs out there for individuals connected to different systems. Not only if you call our on-call system can you be connected to treatment, but we also operate a warm handoff program in coordination with Scranton Counseling Center that operates out of the Geisinger Community Medical Center's emergency department. We have certified recovery specialists, so peers like you have here at the Recovery Bank, who are embedded in the emergency department in the crisis system at Geisinger Community Medical Center. And if you or your loved one were to go to that hospital, maybe for a mental health crisis or because you're struggling with an alcohol or substance use disorder, you can be seen by a certified recovery specialist right in the hospital who will connect you to treatment if appropriate. That program's been up and running for about 3 years now. We've served about 500 individuals through that warm handoff at Geisinger CMC. It's been very successful to connect people to treatment. So that is always a resource. If you don't want to call our on-call number, or if someone ends up at the hospital, that's another way to engage in treatment immediately. So that's very exciting. My staff work heavily on that project, and we always talk about, if someone calls, that they can go to the hospital as well. There are connections to treatment through the 2 other hospitals in Lackawanna County. There are not certified recovery specialists embedded there, but they can reach out to the folks at CMC and begin that part. The work of the CRS at the hospital, I think, is the most important. We know that people who are struggling with a substance use disorder would prefer to talk to someone who's been through that. They would prefer to talk to someone who can relate to them, who can share their experience. And that person really does just that, talks about their own experience with their own addiction, and then shares their own hope for recovery. And we've found that to be very successful in getting individuals to engage in treatment. So we're excited about that project potentially expanding, and we're actually looking to expand some of those resources to EMS services, EMT services, because we know people are still, unfortunately, struggling with an opioid use disorder. We know that we are still, regardless of all the work that we've done in Lackawanna County to reduce opioid use and fatal and non-fatal overdoses, we know that individuals, especially now during the pandemic, are really, really struggling. So we are looking to expand our warm handoff efforts to EMS services, where someone comes in contact with an ambulance company or comes in contact with law enforcement, that they'd be given the option to either go to the hospital, or they'd be given the option to contact my office's on-call to begin the engagement in treatment. Part of that project is Narcan, or recovery kits, that include 2 doses of Narcan. So we are really looking at ways that we can get resources out there, not only treatment resources, but harm reduction resources out there to the community, so that we're part of the solution to the opioid crisis. And that's also work that we've done through the Recovery Coalition. So we are looking to expand our Narcan or naloxone efforts through our warm handoff projects. And part of those recovery kits that we're using through the EMS service include resources to connect to treatment through my office. So there's always a way to get in contact with someone who can help you get into treatment. We have a lot of projects right now. We are very busy. We just started, in coordination with the Lackawanna County District Attorney's Office and the Lackawanna County Court System, we just started a Fresh Start Diversion program, which is I'd compare it to a problem-solving court or a treatment court program like we already have in Lackawanna County that's been very successful, but it's for those lower-level crimes. It's for individuals who, it might be their first offense, perhaps they have a summary charge or a low-level drug possession charge, and really, they're struggling. They're struggling with whatever their substance of choice is, and they have gotten themselves arrested. So we are coordinating with law enforcement, we're coordinating with the district attorney's office to talk to those individuals on the front end before they even get to, say, their court hearing, and then get them engaged in treatment services in hopes that they be successful in their treatment and perhaps their charges can be dismissed or dropped moving forward. So we just started that program as a pilot this last month, and we are already serving about 10 individuals through that project, and we're looking for additional people to come through. So that's another project that we're working on, simply because we understand and see the connection between the criminal justice system and criminogenic factors and someone with a substance use disorder. When you look at the data through, say, the Lackawanna County Prison or individuals connected to the criminal justice system in Lackawanna County, you see that there's a high percentage of those folks who struggle with a substance use disorder. So we are really trying to find opportunities to expand treatment options for individuals through the different systems. So, this is kind of on the front end, getting them engaged in treatment right when they're arrested. And then we are obviously engaged through case management support to the Lackawanna County problem-solving courts, which again, there are so many. There are staff who work here at the Recovery Bank who are instrumental in some of those programs. So we are supporting those efforts and will continue to do that in the future. So we're busy. In addition to some of the law enforcement projects that we have or the criminal justice projects that we have, the Lackawanna County Prison, in conjunction with my office and other entities in the county, has just created, with the help of the Lackawanna County Commissioners, a behavioral health department, which is pretty major. That's not been the case before. So now individuals who come into the Lackawanna County Prison who are struggling with a behavioral health problem will be seen and treated for that behavioral health problem on the front end, and then hope to be released to the most appropriate treatment sooner rather than later. And that is very, very, very exciting. Part of that will hopefully be the engagement in appropriate medications to treat whatever that person's disorder might be. That way, when they are released from the prison, they're already on the road to recovery, or at least starting that journey out prior to release. So that's very exciting, and that's part of some of the reentry efforts that are happening here in Lackawanna County in aid of those reentering not only the criminal justice system, but any of the systems really. So that's another project that my office has been involved in. In addition, we know that individuals who come here to the Recovery Bank sometimes come because they don't know where else to turn. Perhaps they're homeless, perhaps they have some non-treatment related needs that they're trying to deal with. So my office has recently been awarded a grant to provide housing resources to individuals struggling with an opioid use disorder or a stimulant use disorder. So, stimulants, thinking of individuals on an amphetamine, cocaine, methamphetamine, which we know is unfortunately becoming a huge problem here in Lackawanna County. So we have grant money through the Department of Drug and Alcohol Programs to provide up to 6 months of housing for a unique individual who has an issue with either an opiate or a stimulant. That person is supposed to be engaged in treatment or have completed treatment, but really we know housing is a huge barrier here in Lackawanna County for individuals obtaining and maintaining their recovery. So the goal is to have a conversation with someone who's looking for housing and to get them into housing and work on the treatment piece when it's appropriate. I think the challenge we have with this project is really there's somewhat a lack of affordable housing in Lackawanna County. So we do have the money. We have individuals who need the housing, and now we're looking for the actual units to house individuals. So, putting that out there, if you are a landlord or someone watching this who is willing to work with us on this project, we do have money to cover the cost of housing for individuals who need it. And we know that if someone is struggling with a substance use disorder and they don't have stable housing, their chances of maintaining their recovery are pretty unlikely. So we are really looking at a holistic approach to providing treatment to individuals, and part of that is providing the housing as well. If for some reason someone needs housing who's watching this and does not have an opioid use disorder or does not have a stimulant use disorder, and really, does have a substance use disorder and still needs those resources, I suggest you call us. We have other ways that we can assist with housing, should that be one of your barriers to connecting to treatment. So again, I don't want to say it too many times, but our on-call number is always available for individuals who need to access treatment, non-treatment needs, regardless of what the scenario might be. So that's kind of the main gist of our projects. We are always looking for new initiatives. We are hiring additional staff because the needs within the county continue to expand. As mentioned, we do pay for not only inpatient treatment, but outpatient treatment. We contract with pretty much every outpatient provider here in Lackawanna County, and we have some really great outpatient providers in Lackawanna County. So, we leave it up to the client's choice as to where they want to go to treatment. We don't prescribe where they need to go. I know for a long time that was kind of the way things worked, that, you have to go here for this and here for this. We really try to make individualized treatment determinations based on, where the client lives, where the client is interested in going to treatment. We know some clients have some more challenging needs that might benefit from a provider that does, deals with some of their mental health issues as well as their drug and alcohol issues. So we are able to accommodate any request to the best of our ability, and we're happy to do that. We are also looking to hire a certified recovery specialist or partner a little bit more effectively with places like the Recovery Bank to provide resources for certified recovery specialists, because we continue to see the value in that, and we see the peer movement to be very, very important in keeping individuals on the path to recovery. In addition to the outpatient services that we pay for, we also cover treatment for individuals who are on medication-assisted treatment. We know that if someone has an opioid use disorder, that access to medication-assisted treatment or medication-assisted recovery, however you choose to refer to it, is the most appropriate treatment option. So we are able to cover the cost for, say, buprenorphine. If someone is interested in buprenorphine or Suboxone, we are able to cover the costs for individuals who are on methadone maintenance, which is one of the oldest medications for folks struggling with an opioid use disorder. And we are able to cover the costs for individuals who are looking to get on Vivitrol as well. And we contract with some providers to assist with that piece of it. So there should never at this point be a reason why someone does not connect to the most appropriate treatment, unless, of course, the barrier is fear or stigma, which we know continues to be a problem within Lackawanna County. And we continue to try to share the message that, recovery is possible, that people can and do recover if they get the help that they need, that substance use disorder is not a choice, that this is a chronic disease, just like any other chronic disease, and unfortunately people at times do have a reoccurrence of their disease, and we are always there to assist in those cases. and happy to help in any sort of way that we can. So in closing, I don't know that I have much more to share, but I did want to reiterate our on-call number is 570-840-8475. And again, that is 24/7, every day, every night. I will have a staff person who is on call. So if you or your family member is struggling, please reach out or stop over to our office across the street at 100 Wyoming Avenue in the Government Center. And we are always happy to help someone who needs to go to treatment. So in closing, I appreciate the opportunity to share. I know that this is not an interactive segment. So if anyone has any questions for me directly after this, you could obviously reach out to the folks here at the Recovery Bank, but my direct telephone number is 570-963-6820. So if you need to reach me or have any questions, please feel free to give me a call. Thank you.